Senate Committee on Health, Education, Labor, and Pensions will come to order. Let me begin by thanking Mr. Bancel, the CEO of Moderna, for being with us today, and all the other panelists who will be joining us. Mr. Bancel very early on agreed to be here voluntarily, and I appreciate that very much. I also want to take this opportunity, so there is no confusion, to congratulate Moderna, Pfizer, other companies, and the great scientists at the National Institute of Health and other federal agencies for their extraordinary work in rapidly producing COVID vaccines that have saved millions of lives. We should be grateful to all those in government and in the private sector who work so hard to save lives. This hearing, to my mind, is about several enormously important and interrelated issues that are on the minds of the American people. In the pharmaceutical industry today, we are looking at an unprecedented level of corporate greed, and that is certainly true with Moderna. Today, according to a recent survey, 37% of the American people could not afford the prescription drugs their doctors prescribe. Got that? Over 1/3 of the American people can't fill their prescription drugs that their doctors prescribe. Meanwhile, 10 major pharmaceutical companies made over $100 billion in profit in 2021, a 137% increase from the previous year. In these same corporations, the 50 top executives made over $1.9 billion in total compensation in 2021 and are in line to receive billions more in golden parachutes once they leave their companies. In other words, all over this country, in Vermont and in every state represented here, people are getting sicker and in some cases dying because they cannot afford the outrageous cost of prescription drugs while these companies make huge profits and the executives become billionaires. Further, and many Americans don't know this, the taxpayers of our country have spent many tens of billions of dollars over the past decade to research and to develop life-saving medicine. And in my view, that is a good investment. Yet, despite that huge amounts of money and the vitally important work done by the National Institute of Health scientists, the citizens of the United States pay far more for prescription drugs than do the people of any other country on earth, in some cases 10 times more for the same exact drug. Unbelievably, there are important life-saving drugs on the market today that literally cost hundreds of thousands of dollars, cancer drugs and other types of drugs. And my simple question is, what does a life-saving drug mean for a person who cannot afford that drug? You have all the great drugs out there in the world, but if you can't afford it, what does it mean? Now, in terms of Moderna, the focus of our attention this morning, let us be clear. The NIH and other federal agencies work with Moderna to research, develop, and distribute the COVID vaccine that so many of our people have effectively used. While Moderna may wish to rewrite history, it is widely acknowledged that both Moderna and the NIH created this vaccine together. According to a letter I received from the NIH on March 17th, and which has been distributed to all members of the committee, 3 scientists at the NIH, quote, are co-inventors, end quote, of this vaccine who were, quote, integral members of a collaborative team of scientists working to design and produce the vaccine. In other words, this vaccine would not exist without NIH's partnership and expertise and the substantial investment of the taxpayers of this country. As a matter of public record, U.S. taxpayers spent $12 billion on the research, development, and procurement of the NIH Moderna COVID vaccine. And here is the thank you that the taxpayers of this country received from Moderna for that huge investment. They are thanking the taxpayers of the United States by proposing to quadruple the price of the COVID vaccine to as much as $130 once the government stockpile runs out. At a time when it costs less than $3 to manufacture the vaccine. $3 to manufacture it, $130 on the market. What this means is that Moderna will be charging Medicare, Medicaid, the VA, the Department of Defense, the Indian Health Service, and insurance plans, private insurance plans on the Affordable Care Act, billions of dollars more for the COVID vaccine. So all of us who are concerned about the deficit, the national debt, billions more goes to Moderna. Meanwhile, Moderna has already made $21 billion in profits off the COVID vaccine during the pandemic, and 4 of Moderna's executives and investors collectively became more than $10 billion wealthier as a result of the massive taxpayer investment into that corporation. As soon as Moderna started to receive billions of dollars from the federal government, Mr. Bancel literally became a billionaire overnight and is now worth over $4 billion. He was also able to secure a golden parachute for himself worth another $926 million after he leaves the company. But let's be clear, Mr. Bancel is not alone. One of Moderna's co-founders, Noubar Afeyan, is now worth $1.8 billion. Another co-founder, Mr. Langer, is now worth $1.7 billion, and one of the founding investors in Moderna, Tim Springer, is now worth $2.2 billion. None of these 4 individuals were billionaires before the taxpayers of our country funded the COVID-19 vaccine. This type of profiteering and excessive CEO compensation is exactly what the American people, whether they're Republicans, Democrats, or independents, are sick and tired of. And that is why this morning I will be asking Moderna and Mr. Bancel to reconsider their decision to quadruple the price of this vaccine and not raise the price at all. Let me mention that after this hearing was announced, Moderna pledged that its, quote, vaccines and boosters will continue to be available at no cost for the vast majority of people in the United States, end quote, through the creation of a patient assistance program. That is good news. The bad news is that most patient assistance programs are poorly designed and extremely difficult, and I will be asking Mr. Bancel to make certain that this patient assistance program is simple, non-bureaucratic, and in fact gets out to the people who need it. Let me pose, if I might, a moral question that we ask too rarely, but that I hope that this committee will address in the months in front of us. And that is, above and beyond the COVID vaccine, should people in our country and around the world get sicker and sometimes die because they cannot afford the outrageous prices that the drug companies are charging? Is it morally acceptable to say, I have a drug here that can cure you, save your life, but I'm sorry you can't afford the $50,000 that it cost? Is that the moral values of the United States of America? And I would contrast that attitude that we see today from Moderna and virtually all the other drug companies with what Jonas Salk said when he invented the polio vaccine, that had such a profound impact. And you know what he got for inventing the polio vaccine? He got nothing. And he was proud of it. He gave a gift to the world that saved God knows how many lives. So I think we need to do some moral thinking about the role of the drug companies in our society, and I hope this committee will get into that. And with that,